Hello, this is Intro to Pandemics. This is a quote from Dr. Fauci. He said, when people used to ask me over the years what it is that I most worry about with regards to emerging infectious diseases, is that a respiratory-borne illness that spreads easily from person to person, but then has a high degree of morbidity and mortality. And unfortunately, that's the worst nightmare you can have, to have something like that. So Dr. Fauci has been saying this for the last few decades. Are things really so bad? Yes. Should I panic? No. Why not? Because it doesn't solve anything. What do you mean by bad? Well, up to 2 million people could die in just the USA. That's if we do nothing. So, no, we're not overreacting. Are we underreacting? Yes, in many places we are. California is doing a great job, though. Thanks, Governor Newsom and your team. So are we prepared? Not enough. We're working hard to get there, though. Why not? Yeah, we'll get back to that. Is there hope? Yes. Lots of it, and always. You'll learn about things you can do now and about the promising breakthroughs that are happening frequently thanks to scientists all over the world. So, why is COVID-19 so dangerous? It is new. It is extremely contagious. It is transmitted through the air we breathe. And it is infectious for 2 weeks before you have symptoms. Let's break this down. It is new. Why is that difficult? Well, we don't have key info about it. We don't already have immunity to it. We don't have a vaccine. We don't have well-proven diagnostic tests. And we don't have treatments. What is this key info? Well, for a pandemic, we'd like to know how it is transmitted between people, when is it most infectious, how long does it last on surfaces, how does it enter cells, how does it replicate itself, how does it cause illness, what is our immune response to it, how long does our immunity last once we successfully fight it off, and what are other risk factors? Okay, we know some of this info, but not all, and we're learning a lot fast. We'll learn more about this next week in class. A moment of science. Coronavirus is a type of virus. COVID-19 is the actual disease, and SARS-CoV-2 is the virus that causes the disease of COVID-19. Fun fact, so to speak, there are zillions of types of viruses and lots of coronaviruses too, in fact. Some probably gave you a mild cold last winter. Some are deadly. They're not all the same. So let's continue to break this down. It is extremely contagious. R naught is a way that we measure how infectious a microbe is. If the R naught is a value of 1, we can contain it. That's one-to-one transmission. It only takes an R of 2 for something to become a pandemic. The 1918 pandemic that killed millions of people across the world had an R of 2. R of 3 to 4 is the current rough best guess for SARS-CoV-2. Roughly, that means that each infected person then goes on to infect 3 more people, who then infect 9 more people. And this is why a few cases one day means thousands a week later. This is what you've heard of called exponential contagion. So let's continue to break this down. It is transmitted through the air we breathe. It's kind of hard to avoid air, and we are constantly swapping airborne molecules. So, when you cough, as you know, you expel a lot of molecules, but you expel some molecules when you shout and also when you talk, yes, although relatively less molecules. These molecules end up on our hands and on the surfaces we touch, then onto the hands of other people, into their noses and mouth. So when we are infected, anything we touch or cough near is a likely way to pass along the virus. So why must I stay away from people for, 6 feet away from people? Because when we cough, the virus that I expel can land 3 to 6 feet away. That's how we came up with 6 feet. It wasn't random, because you might notice at 6 feet, we can still reach out and touch each other. So yeah, please don't, unless you already live with the person you're touching and you've exposed them anyway. Let's continue to break this down. You can be infectious for 2 weeks before you have symptoms. I'm going to repeat that. You can be infectious for 2 weeks before you have symptoms. Yes, this is scary. So, do you feel fine? Great. You should consider yourself contagious and act accordingly. So, let's break this down. What should I do? If I have no symptoms or maybe a mild cold, I should consider myself contagious, stay at home. If I'm actively sick, I should call a doctor, they will screen me, maybe order a test. I stay at home. I'm so sick I can't breathe, well then I might need a hospital, let's talk to a doctor about that. An MD, by the way, not a PhD. So, stay at home. Yes, you. Yes, me. Yes, us. All of us. So we're staying inside and practicing social distancing and cleaning ourselves. Congrats, my friend. We've become a house cat. So why does this work? We come into contact with a lot less people. Yeah, but what are the chances? Well, it's possible that 70% of us are contagious right now. We just don't know. Let's look at this graphic. This shows exponential spread, 1 person to 3 people now sick, to 9, 27, onward, lots of sick people. This is what the coronavirus, the current one, is doing. If we shelter in place, here's the different ways people are sheltering in place, you can see that we cut down the transmission. There aren't so many chances for the virus to find new people to infect. This is a great graphic. This shows the cell phones of just a few hundred people on a beach in Florida recently in March. And then in a week or two, this is where all those people spread out to, probably bringing the virus with them along for the ride. So do we know that shelter in place works? Yes, so far it has. In fact, here's a pretty bleak comparison of California, which sheltered in place earlier, to New York in late March. So California and New York City got their first cases around the same time, but California was quick to order everybody to shelter in place. And so far, we're doing better. And we're not overwhelming the capacity of the healthcare system. So you've probably heard that what we're trying to do is to flatten the curve, because even if everybody's going to get sick, because eventually this virus will find its way to everybody, even with shelter in place, at least we're slowing down when people get sick so that the healthcare system doesn't have to take care of so many people at once, and we're not overwhelming our capacity. And just to be super clear in this curve, you see where it goes over the healthcare system capacity? A lot of these people could end up dead. I mean, a lot of these people are going to really need those hospitals and won't be able to get them. So is there a better way than just sheltering in place? Yes, it's called test and trace. First, you test everybody to see if they're infected, if they're sick, and then you trace their contacts. And you quarantine only the infected people and the people they've come into contact with. So, do we actually know that this method, test and trace, works? Yes. Yay. South Korea had their first verified case the same day as the first case in the USA. We kind of watched and debated what to do. South Korea sprang into action. They instituted widespread testing plus quarantines only for infected people and anybody they may have come into contact. Look at the trajectory of their disease as opposed to Italy, Spain, the US, UK, etc. In fact, as of April 5th on 2020, South Korea, with a population of about 52 million, had about 10,000 recorded infections. Note that they tested almost everybody. They did a high rate of testing, and they had less than 200 deaths from COVID-19. The US, about 6 times more population, has a lot of, like 300,000 recorded infections. And note that we only test the very sick people, so there's a lot more people infected out there. And we're nearing 10,000 deaths. So not only does test and trace act quicker, more effective, slow down the contagion, but it's actually cheaper, and it doesn't crash the economy so badly. Because you don't have to actually shut down the entire economy, you just shut down pockets of infectious people. So South Korea was prepared because they were really affected by previous coronavirus pandemics. There was SARS and MERS, and they had a lot of great ideas ready to go and snapped right into action. I particularly love these testing booths where people can just be tested individually with high levels of PPE, personal protective equipment, or thermometers at building entrances, and so on. These are great reports showing some of the things they did that worked so well. So why aren't we doing it that way through test and trace instead of shelter in place? Exactly, great question. No, really, why not? Well, we weren't prepared this time. People might have some pretty good issues with the amount of information that has to be shared with a central entity like the government. So they have to know your medical history plus your movements and who you know. Also, there's a lot of denial. It's human nature. We haven't been trusting scientists. We have bad political leadership in a lot of places throughout this country. So can we still do it? Yes, in the future, but note that it's most effective early on. However, at any point, it is still useful to test as many people as possible. The more info, the better. So test, test, test. This is how we will get all the info we need and also be able to stop the contagion. And even the director of the World Health Organization says this. So is this info as upsetting to you as it has been for me when I first learned it? If so, feel free to vent your anger productively now and then when you vote. Meanwhile, shelter in place. It's our absolute best option right now. So as it says, I don't know what this cat is going through, but I can relate. And if 2020 was a slide, boom. Okay, so what can I do now? What to do? So, it's your new best friend. It loves you, you loves it. Soap rips apart the virus. Here's how. Watch this video. Basically, it destroys a little bit of outer lining of fat that's keeping the virus together. And then once that's gone, the thing is harmless as all get out and can't kill anyone. So, an important point, you'll hear people talking about finding RNA, etc. The RNA of this virus is not infectious by itself. The virus needs to be intact. It needs to have RNA plus a layer of fat and some proteins around it in order to cause any trouble. When soap rips that apart, rips everything into shreds, it destroys the virus. So wash your hands. Here's a great little video, very beautifully instructional. So continuing on the what to do theme, well, there's always alcohol. Yeah, Tabasco hand sanitizer. Touch your face now, we dare ya. Anyway, so yes, alcohol is what the magic of hand sanitizer. It's almost as good as soap, and it sometimes is easier to use because it evaporates, etc. It needs to be at least 60% ethanol or isopropyl alcohol. So yeah, the stuff we drink is not enough, not concentrated enough. At least I hope you're not drinking anything 60%. Um, okay, so pro tip. Guess what scientists use to extract RNA from coronaviruses? Yes, soap and alcohol. They are powerful. So those diagnostic tests where they're finding the presence of the RNA, first they use soap and alcohol to bust open and destroy the virus, and then they look at the RNA they found. So what else can you do? Wear a mask. Yes, this family in California even protected their cat during the 1918 epidemic. So why do you wear a mask? You wear it to protect you from others and to protect others from you. Currently, we have a mask shortage because we weren't prepared. So for now, the priority goes to frontline workers. Handmade masks, other things work much less well. They protect you maybe by 40% instead of 90% or 70%, but they're better than nothing. So an N95 mask, it filters the outside air before it gets to you, so it works to keep stuff away from you. A surgical mask is just a covering that works to keep anything you cough or talk or spit out to yourself, so it doesn't go past you. What else can we do? Well, we're basically practicing sterile technique everywhere. And you'll learn more about laboratory level aseptic technique, as it's called, later in this class. For now, the basics is be aware of what your hands touch. Your hands are passing along the virus. That's the way you need to think. Unless you've just washed them nice and thoroughly with soap, then okay, there's no new virus on there. They're probably fine. This is a great video just to show you how quickly germs can spread at a simple dinner. We're always sharing our germs. That's just the normal way that we exist, and it's normally fine. Right now it's a problem. Okay, so what to do? Of course, stay at home, safe at home, as we're saying, unless, of course, you are a frontline worker, essential worker who is having to go out and thank you for your service. But if you can, stay at home. You're safer there and you're helping everyone out. If your home's unsafe for other reasons, there are resources. Now's the time to move. We're probably going to be sheltering in place for quite a while, actually. So this is Italy, as we know, is one of the hardest hit countries for various reasons. We're going to look into that next week a little bit and compare countries. The slogan there is Io resto a casa, I'm stay home. This is from my hometown. Some nurses saying, please stay home so we can help you. This is a lot of kids are doing this, andrà tutto bene. Everything will go okay. In the end, it'll be okay. So what else can I do? What else can we all do? Let's be sure to listen to only trustworthy sources of info. There's a lot of misinformation around, and that's dangerous. So good sources are Science Magazine, New York Times, The Atlantic, Johns Hopkins University, our governors, Gavin Newsom, Andrew Cuomo, Dr. Anthony Fauci, anyone else. I mean, the White House is extremely inaccurate, and it's very dangerous. So just don't even deal with the misinformation coming from there. Anthony Fauci works for the National Institutes of Health, not the White House. And he's excellent. He was a hero in the AIDS epidemics, and he's guided us through Ebola and other epidemics, and he really knows his stuff. Okay, what else can you do? Boost your immune system. You already know how to do this. You know, de-stress, self-care, laugh. These are some great videos. I mean, Samuel Jackson to the rescue, telling us stay the F at home. And this family from England singing, repurposing the Les Mis song. So exercise, delicious food that's nutritious, try to get your sleep in. Self-care is big right now. It's a scary time. There's a lot of change. We don't know how it's going to end at this moment. So, you know, take care of yourself as much as possible. So, wow, this has been a surprise, right? Nope, we were warned. We just didn't listen. Infectious disease scientists have been telling us for decades that this kind of pandemic was going to happen at some point, and we are mostly unprepared except for a few countries. This is a great article about that. And then, I mean, even Bill Gates, he's not a scientist, but he talks about exactly this disease 5 years ago in this video, if you want to see it. He works in World Health. So, you know, a lot of people have been sounding alarm bells. And I know even I love science and I listen to scientists, even myself, it was hard to kind of notice that. And really, it was up to governments to prepare us. And well, now we're making up for that. And hopefully next time we will do better. We're not one planet. I mean, we are one planet. We're not separate countries. Sorry. We are to the virus. We are one planet to the virus. And we need to respond globally too. So, and a thing that infectious disease tells us is poverty kills everybody, including rich people. So our weakest people who have stressed immune systems, who maybe don't have health care, um, that hurts everybody. We need to help make sure that everybody has access to health care and enough food and can survive, etc. So justice, it turns out, is good medicine too. By the way, something else scientists have been warning us about a lot: climate change. It is devastating to almost all life on Earth. But it's a bonanza for new viruses that are emerging as we thaw out things and crossing our paths as we destroy the natural habitat. Here's some resources about that. And I think this cartoon pretty much summarizes it. This is bad. Climate change is unfortunately even worse. I like this meme. It's a world. There's no way we can shut everything down in order to lower emissions, slow climate change, and protect the environment. Mother Nature. Here's a virus. Practice. Okay, so fossil fuels, brought to you by the virus-sponsored pro-pandemic lobby. Let's not listen to them. Okay, how about some good news? Well, science and scientists are working hard. Chinese scientists did a wonderful thing in that they published the viral genome on January 10th, 2020 for worldwide use. And scientists all over the world are refocusing their research. They're collaborating. They're finding solutions at record speeds. And there are many solutions, quicker and more accurate, for testing people to this virus. Then what about solutions? Okay, now we know you're sick. Is there something we can do? There are hundreds of clinical trials that have been registered and started worldwide already for possible treatments and also vaccines to prevent this from spreading. The tests themselves are there are two general types. There are PCR-based tests that test for the presence of the virus in the way back of your nose. And they tell you, these are the nasal swabs, they tell you you're infectious or sick because they find the virus in you. And PCR is polymerase chain reaction. It's a way that we are able to make a lot of copies of the RNA from just a few copies. So you just get a few viruses and we can say, yes, it's there. It was found in this person. The blood-based tests, or known as serological tests, are different. They take some of your blood and they look for the antibodies that come from this illness. So it says that if you have these antibodies, it says you've survived the illness and you might be immune to it now. We don't know, but it's possible. But you had it and you're past it. So among the solutions, there's sort of three different themes. One is, let's repurpose drugs we already have. And this has already been tried. We're already in the middle of doing this for many drugs. There's an Ebola drug that might work. There's HIV drugs that are called retrovirals that might work, and so on. This would be great if we discover that, because hey, now we have a drug that can help. And we already know its side effects in humans. Another thing that has been done already and is being tested to see if this works, but it just might, is we are using those antibodies from blood of people who have already survived and turning around and injecting them into people, giving them the antibodies. Because if you have antibodies, that's your immune system's way of tagging the virus and saying, hey, destroy this. Okay, so this is what the point of vaccines is, actually to give a test run to your immune system so they know to recognize the virus. So this is sort of jumping over since we don't have a vaccine. And of course, we are trying to develop new vaccines, but it takes a while to see if they work. Here's a nice graphic showing you these 3 different general ways of looking for solution: repurposed drugs, using antibodies from people who have already survived. So taking their blood, processing it, and then taking the antibodies, which are proteins, and giving them to sick people. And then, of course, we're working hard to develop vaccines. In fact, that same Bill Gates is funding factories for 7 vaccines at once. Instead of like waiting to see the one that works, he's just like, any good leads, we're going to get going. We're going to make them. Here are some of the quick tests. There's many, many tests that have been developed. This is a famous researcher who, Jennifer Doudna, discovered CRISPR, and she is turning her whole lab into a testing site, basically. A lot, just shows you a lot of scientists from different fields are coming together and going, we got to defeat this contagion. Here are some of the clinical trials. This looks really, this isn't a very exciting drug. Remdesivir and other, they're just a lot of things. Everybody is trying anything possible at this point, and there's a lot of good leads. So there's great community responses too, right? People are stepping up to help each other in so many ways, from the Italian singing in quarantine to free online newspaper articles, art books, museums, plays, internet, homeschooling resources, etc. There's these mutual aid groups. You can look this up. Lots of volunteering, free donuts and free unused RVs for frontline responders. We're working hard to provide ventilators and masks. 3M workers striked until 3M just said, yep, we'll produce ventilators. There's lots of creative ways of making these. You can go online for Citizen Science link to producing ventilators. This is for if somebody's in the hospital, can't breathe, it's the last ditch effort, but we want to be able to do that. If you don't have insurance, at least in California, you can go enroll. And also you can be part of some citizen science studies at your home if you'd like to. And I'm going to end with this quote from the Reverend Dr. William Barber. This virus is teaching us that from now on, living wages, guaranteed health care for all, unemployment and labor rights are not far left issues, but issues of right versus wrong, and life versus death. So coronavirus is also, there's kind of a paradox. It's saying don't touch each other, but yeah, give each other your blood to survive. So anyway, compassion is survival in an epidemic.